Good morning, everyone. Good afternoon, good day. This is actually Angel, and I came from BSB 2-4. So for today, we will gonna discuss about the obsessive compulsive disorder. So for this, we will gonna discuss the diagnostic criteria, its prevalence, the development and course, and lastly the treatment. So for the diagnostic criteria, um, definitely, we do have two definitions that we need to discuss. So, before anything else, when you actually think about the obsessive compulsive disorder, technically in general, people will think it's just about perfectionism. It's about being organized excessively. It's being about being so clean. So although they are entirely true, with this discussion, we're gonna further have the discussion deeper of what OCD is. So, for the diagnostic criteria first of the OCD, it says here the presence of obsessions, compulsions, or both are existing. So, let's talk about what is obsession. So, obsession are defined by two definitions. So, first is recurrent and persistent thoughts, urges, or images that are experienced at some time during the disturbance as intrusive and unwanted, and that in the most individual cause marked by anxiety and distress. So, these kinds of obsessions, these kinds of unwanted or intrusive thoughts, urges, and images are actually being routed back or traced back to their um, the feelings of anxiety and stress that they do have. So, when we say intrusive and unwanted thoughts, urges, and images, definitely they are far away from normal. So, for this, let's define the second one. So, it will be the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thoughts or action. So, for this, people with OCD and having obsessions, definitely they are still trying to ignore or suppress such things and to neutralize them or to balance out this kind of thinking. Definitely they will gonna perform a compulsion or an action to actually cope up with what they are feeling for their stress and anxiety that they're feeling in a specific idea that they do have in their mind. So moving forward, compulsions are defined by two definitions as well. So the first is repetitive behaviors or mental actions or mental acts that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. So these specific actions are their way to actually cope up or to come up with their obsessions. So, in this case, they are thinking that this must be done. Like, for example, there are people that have this obsession and to actually resolve that in their own way, which is again far from normal. Um, they are being dogmatic or doing a ritual for that specific action. So, like, for example, um, someone is thinking that someone is actually having a fear of germs. So for this case, they are actually have this idea that in after an hour, definitely everything is dirty in there, and so they will gonna clean up themselves every after an hour. So that's the ritual that they are doing. So the behaviors or mental acts are aimed at preventing or reducing anxiety or distress or preventing some dreaded event or situation. However, these behavior or mental acts are not conducted in a realistic way with what they are designed to neutralize or prevent or are clearly excessive. So that's what we need to remember about the compulsions. These are the action towards the obsessions that someone or an individual do have. They are doing this to reduce the anxiety and the distress that they do have. So For cases like this, they are also doing this to suppress the a specific event or dreaded situation. So in that case, they can suffice themselves to, or satisfy themselves the feeling of safe, or let's say reducing their anxiety or their stress. So now let's proceed with the criterion B. The obsessions or compulsions are time consuming, at least an hour a day, and definitely cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So definitely having an OCD is actually, it says here, time consuming, meaning this is deteriorating as well their daily life functions. So since they do have this thinking that this must be done in a specific time in a day, like for example, or in a specific situation in a day, definitely um, those actions that is far away from normal will be conducted by them. So for the criterion C, the obsessive compulsive symptoms are not attributable to the physiological effects of a substance like drug of abuse, medication, or another medical condition. So for the last diagnostic criteria, the disturbance is not better explained by the symptoms of another mental disorder like the GAD or generalized anxiety disorder, body dysmorphic disorder, hoarding disorder, trichotillomania, excoriation, stereotypic movement disorder, eating disorder, substance-related and addictive disorder, um, those with illness, anxiety disorder, paraphilic disorder, and the major depressive disorder, as well as the schizophrenia spectrum and other psychotic disorders, and lastly, the autism spectrum disorder. So, those are just some that should not be associated with, you know, diagnosing someone with an OCD. So, we do also have our specifiers. Our specifiers will be good or fair insight. The individual recognizes that obsessive compulsive disorder beliefs are definitely or probably not true, or that they may or may not be true. With poor insight, the individual thinks obsessive compulsive disorder are probably true. With absent insight, delusional beliefs, the individual is completely convinced that the obsessive compulsive disorder are beliefs are true. So the difference within these three, among these three, are actually just the degree of how they believe a specific thoughts or just or images are actually true, which in we know that is far away from normal. So with a good and fair insight, they still recognize that it may or may not be true. There is still in the middle ground of reality, normal and not normal. So for the poor insight, they are thinking that it is probably true. So they are thinking that it is not it is less true, although the weight of believing that it is true is much higher. So for the absent insight, this is when things are actually heavy, since the people with OCD with this kind of specifier is actually believing that their belief is actually true. So for now, we do also have this table in here. We do have the symptom subtype, their obsession and compulsion. So this is just an example from the book Abnormal Psychology by Barlow. So we do have the symptom subtype, the symmetry, exactness, or just right. It is when you are actually needing things to be symmetrical. You're trying to organize things as much as possible until you're gonna satisfy yourself. So they're repeating a ritual to organize things out in a certain order. So we do also have forbidden thoughts or actions. We do have fears, urges to harm self or others. We also have fears of offending God as obsessions in this part. And they are tend to check, avoid, or repeat requests for reassurance. So the third is cleaning contamination. This is the fear of germs, which we discussed earlier. And they are repetitively washing themselves excessively So they're also meticulous using gloves and masks doing their daily tasks. So lastly, we do also have hoarding, fears of throwing away anything away. So which we're gonna discuss later on. So the compulsion for this is they tend to collect and save things without or with actually a sentimental value in their part, but in reality, um, it's far from their actual value. So for the prevalence, women are affected at a slightly higher rate than the men in adulthood. And in men, this is actually occurring in their childhood the most. So during childhood, men are more prone for the OCD. So for the onset, development, and course, men have an earlier age at onset than women. The onset of symptoms is actually gradual, typically gradual, but it can also occur acute. So if OCD is untreated, the course will usually be chronic, often with waxing and waning symptoms. Some individuals have an episodic course and the minority have a deteriorating course. Onset in childhood or adolescence can lead to a lifetime of OCD. So for the treatment for the OCD is actually to uptake of serotonin such as clomipramine, the SSRI or the SSRI, the exposure and ritual prevention, and lastly a psychosurgery. So that will be all for today. So to summarize it all, the obsessions and compulsions are way related to each other. First, obsessions are the thoughts, urges, and images that is actually unwanted. And for this, they will gonna do an action to suppress this specific obsession, which is marked by their anxiety and distress. So they will gonna try to lessen that by doing compulsion. So compulsions, on the other hand, are actions that actually way too far from reality, or let's say way far from the normal. So that's how they actually cope up with their obsession. So that will be all for today, and thank you so much for listening. You have a great day ahead.